Good evening, all. First of all, congratulations on joining this esteemed college. JJMMC has a legacy of excellence, nurturing doctors who are serving all across the world. 250 batch students is a huge batch. So wherever you go, whichever city in our country or abroad, you will meet one or the other student who has studied MBBS in JJMMC. So congrats for that. You will have a huge alumni support. Next, what stands apart our college is the vision which supports it. This vision started long back before JJMMC under Bapuji Educational Association, and that is now continuing with Shamnu Shivshankarappa Care Trust, what we call as SSK Trust. The leaders behind this SSK Trust are our founding trustee, Dr. Shamnu Shivshankarappa ji, who is a visionary educationist, philanthropist, and social leader. He is the driving force behind all our trust activities. Then there is our managing trustee, Shri S.S. Mallikarjun sir, who is a dynamic leader with a vision, who is carrying forward this legacy of SSK Trust. He has involved in many activities, and also all our trust programs are overseen by him. Then we have our life trustee, Dr. Prabha Mallikarjun Madam, who is known for her compassion and commitment towards women empowerment. She is the one responsible for overseeing all our trust programs and make sure that they are rooted in vision and inclusiveness. The trust started its journey in long back, 6 years back in 2019. The first program we started was on women health. We called it as Spandana. I think community medicine HOD had already briefed you about our one of its kind screening center for breast health that is established in SS General Hospital that was done under the trust. We use thermalytics technology, which is basically thermal images, capture breast images, and we run it through artificial intelligence and machine learning to triage women having any chance of breast cancer or not. Similarly, over the years, we also started cervical cancer screening using similar technology. And then we started providing free services for pregnant women belonging to BPL category. We provide antenatal services, natal, postnatal services for all the pregnant women belonging to BPL category. So this program is extended to all the women across across Davangere district. Then in 2021, we started dialysis services. Okay. But first there were 4 dialysis machines, and this is free of cost service which is provided to anybody, not just BPL category. And over the next 3 years, we started adding more and more dialysis machines. Now this is one of its kind dialysis center which is run by private institution, that is SSK Trust, having 16 dialysis machines, and we provide more than 650 cycles each month. This is totally free of cost, no out-of-pocket expenditure for the patients. Then in 2022, we expanded our services to rural Karnataka. We adopted more than 13 villages under Arsapura and Kakarkola PHC and started providing services to the rural population there. The first one we started was child health. We called it as Sukshema. So what we did was, all the children studying in Anganwadi Center, 6-year-old children, were screened for malnutrition and anemia. Then those who found with mild to moderate malnutrition or anemia were supported with IFS syrup and protein supplements for more than 6 months. After this, we didn't want the children go back to becoming again anemic or malnutrition. So what we did was, we started counseling of whom? To the mothers of these 3 to 6-year-old children. We did monthly counseling of these women in the Anganwadi Center. How? So that they can make minute changes in their cooking practices so that child doesn't go back to becoming anemic. Then these services, we extended it beyond these 13 villages. We have extended it to other villages of Davangere district. This is another initiative which is carried out by our interns, that is junior doctors. What they do is they visit houses in these 13 villages under 2 PHCs, and they do screening for NCDs, that is hypertension and diabetes. Then in 2023, we appointed community health volunteers, women, who do the same services in other villages. Along with that, they also provide services for pregnant women also. They do hypertension, diabetes screening for pregnant women so that gestational diabetes or eclampsia can be detected early. This is a very special program. We call it as Sneha Shibira. This is for whom? Children living with HIV/AIDS. More than 150 children in Davangere district are living with HIV. So SSK Trust adopted these children. We provide nutrition supplements to them, do regular health checkups. Investigations are provided free of cost. Medications are provided free of cost. That is apart from their ART drugs. ART drugs are given free of cost from the government. We provide medications for other acute illnesses for them. So, and also we collaborated with Sneha Charitable Trust, that is one of its kind trust, which runs exclusive programs for children with HIV. So collaborated with them, and we run 1 to 3 days life skill workshops for them. The next workshop is scheduled in November for them. More than 30 children are attending that program. We wanted to equip our basic health workers. Heard of ASHAs? Heard of ASHA workers, accredited social health activists who provide basic health services at rural population? Heard of them? Yes. So we wanted to equip ASHAs with life-saving skills, make them aware of life support and first aid. So we started a program and called it as Jeeva Rakshana. They started this in 2022. In that year, we oriented all the urban and rural ASHAs. More than 500 ASHAs were trained in batches of 25 to 30. Then after that, we continued the same orientation program to school teachers of urban and rural schools, government schools particularly. Then community volunteers were trained. Then this year, 2025, we started orienting, that is continuing the program for traffic police personnel who are the first responders during traffic accidents, right? So we started orienting them, which was followed with auto rickshaw drivers also. And from December early 2026, we are continuing it with training of youth, that is college students, medical and dental, PIT, engineering and MBA college students. And we are calling it as Yuva Rakshaka. This is a program called Kaushalya, where SSK Trust collaborated with other professional colleges like Bapuji Institute of Engineering and Technology, Bapuji Management Schools, Law College Schools. What they did was, they brought batches of rural students, particularly higher primary, that is high school students. They spend 1 day in these campuses of these colleges and get trained on basic computer skills, leadership qualities, then basic legal knowledge. And this is also gives them an opportunity where they see how professional colleges run, and it makes them aspire to study better and enter professional colleges. So till now, more than 10 villages students have come and visited the colleges here. In 2023, early 2023, I think, we collaborated with dental colleges, that is Bapuji Dental College and Hospital and College of Dental Sciences. What they do is, along with the support of SSK Trust, they start a school oral health program. They visit government primary schools and teach them on oral hygiene, how lifestyle modifications can help them prevent dental caries, those things. And I think till now they have covered more than 80 to 100 schools under this program. To instill a habit of giving among our students, we started Pratigna program. We started in collaboration with Department of Pathology of both JJMMC and SSIMS in 2023. Here, they orient students on advantages of voluntary blood donation. So under this program, till now we have collected more than 4,500 units of blood. Even though the trust was organizing health camps, since its inception, that is 2019, we didn't have a dedicated mobile clinic. So in 2023, the trust procured its health on, we call this as Healthline or Lifeline on wheels. So it is a bus which is modified so that it has designated space for conducting investigations, consultation and examination. This bus can be set off at any given moment to any remote part of the Davangere district and set up for providing health camps. In 2024, that is March 2024, we celebrated our 5-year anniversary, the journey of care and compassion, and we call it as Samsadhana. During this program, our leaders reiterated their promise, commitment to the community and said that we will continue this and try to expand the services beyond Davangere district. And August 2024, we started this program, Arogyada Arivu. In this program, consultants, experts in their field conduct brief discussions regarding the topic of their interest or the theme of health days for that month and have a brief discussion with the patient, attenders, relatives coming to the hospital. Usually this is once a month talk. We usually conduct on second or third Mondays. This is being conducted in SSIMS hospital. We have a similar program in JJMMC. That's why we didn't start this in JJMMC. This was started in SSIMS. To make students, that is primary school children, higher primary school children, aware of healthy eating habits, how the habits they procure, inculcate today can affect their health over the years. How NCDs can develop over the years. To make them aware of that, we started this program called Sampurna Swasthya Program. So this is one-day program. This was started in collaboration with Indian Association of Pediatrics, Davangere branch. So what we do during this program is we visit schools and in batches, small batches, we have a discussion with students and teachers. Interactive discussion, very interesting program this is. Then 2025, we started with elderly program, called it as Sanjeevani. Under this program, we have adopted the old age homes in Davangere district. I think 5 to 6 old age homes are there in Davangere districts with more than 150 residents. We are conducting biannual health checkups of all these residents. Health checkups are there, then investigations are done free of cost, medications are also distributed free of cost. Those elderly who are eligible for cataract are also brought back to the hospital and free of cost operations are also done for them. So this is another program which we started this year. Like I said before, Kaushalya was mainly for adolescent empowerment program. In 2025, we collaborated with a company called Q Spiders, who are known for their testing and training skills in Bangalore. And with them, and also with the collaboration with Davangere University, we started providing training programs so that for the degree students, BA, BSc, those students, so that they can upgrade their skill and become eligible for IT sector. We called it as Kaushalya 2.0. Then another program we started this year, that is in collaboration with, again, Davangere University and IAS Baba. What they do is, they provide residential free coaching for IAS and KAS aspirants. That program we call it as Sankalpa. Finally, after 6 years, we got our office. We have established SSK Trust office in first floor of new administration building. I think all of you have visited the ground floor for your admissions, right? Please come to the first floor. We have a well-equipped SSK Trust office there with designated space for teaching, orientation programs, and also there is a wall of knowledge. You should see that. I'm not telling much on that. Come and see the wall of knowledge and give your feedback to me. Over the years, more than 15 programs, initiatives have been launched and being run simultaneously, parallelly by SSK Trust. The impact, what you are seeing here, are not just numbers. More than 5,000 women, more than 1,000 pregnant women are supported under Spandana. 22,000, I think this number had got in June. We have increased now. I think 27,000 something is the number now. Cycles of hemodialysis are given free of cost. All this initiative, every initiative, whether small or big, numbers may be 100, 150 or 50,000. That's the population we have reached through our outreach camps. They tell us that SSK Trust is committed to the providing education, healthcare services and outreach services also. So that's SSK Trust for you. This is the one thing I wanted to highlight today, SSK Trust Student Wing. This was started in year 2024, March during Samsadhana, we inaugurated this program. So what we do here is, we brought together students from 7 professional colleges under BA, JJMMC, SSIMS, BDCH, CORS, BIT, MBA College and Law College. So these students were brought together so that we can instill values of service and leadership. They also conduct a variety of activities. I'll just show you a glimpse of them. Over the last 12 months, they have conducted many activities. They may be awareness drives, they conducted walkathons, visit to the old age homes, orphanages, blind schools, many of them. You can see here. So why should you join? Yes, joining SSK Student Wing gives you an opportunity to learn what cannot be taught in your textbooks. How your simple or small act can benefit the larger community. And also you get to interact with professionals from other streams also. Because students from all colleges are part of this. And any program we organize or you organize as part of Student Wing will be interacting. You will be learning leadership skills, you will be learning brainstorming how to plan a program, implement it, monitor it, all those things. And this is a photo. The working body is for 1 year. So this year in September, we inaugurated second year for them, Student Wing, and the new body came into action. And this time, we included 3 more colleges under BEA. That is A.V. Kamalama College for Women and ARG College for Arts and Commerce and DRM Science College. So now totally 10 colleges are there. Students from 10 colleges are coming together for the program under SSK Trust Student Wing. So how to get involved? We SSK Trust, we invite you people to come and get involved in our activities through the Student Wing. But how? There is designated faculty coordinator in each college, designated student coordinator in each college. You can go through them. Or we have our own Dr. Ashwini Madam, who is Director of General Activities. And she is the one who spearheads this SSK Trust Student Wing. She coordinates with all the 10 colleges and makes sure activities happen on time. And this QR code, if you scan this, you will get access to a Google form, which you can use to sign up for being membership for SSK Trust Student Wing. I thank our trustees, Principal Madam, Dr. Nirmala Madam, and her team, the organizing committee behind Foundation course this year for giving me this opportunity. Thank you. We are playing a short video given by our life trustee, Dr. Prabha Mallikarjun Madam, who is congratulating you all for joining our institution and also inviting you to become part of Student Wing.
My heartfelt greetings to all the new students. At the outset, let me congratulate each one of you for choosing to begin your professional journey at one of the premier institutions of Karnataka under the Bapuji Educational Association. You have joined not just a college, but a family that has been dedicated to the cause of education and service to society for several decades. As a life trustee of SS Care Trust and a governing council member of Bapuji Educational Association, I take great pride in the fact that our colleges have consistently upheld the values of academic excellence, compassion, and social responsibility. Through the SS Care Trust, we are working to support healthcare initiatives, educational programs, and community development activities that reach people across both urban and rural areas of Davangere. Our mission is simple: to serve society through education and health. To strengthen this spirit of service among students, we established the SS Care Trust Student Wing in March 2024, which provides a wonderful platform for you to participate in community-based activities, health awareness drives, outreach camps, environmental initiatives, and more. By joining the Student Wing, you become active partners in the Trust mission and develop values that go beyond textbooks and classrooms. I warmly invite all of you to become a part of the SS Care Trust Student Wing and contribute your ideas, time, and energy towards making a positive difference in society. Once again, congratulations to all the students on joining this esteemed institutions. I wish you all the very best for a fulfilling and meaningful journey ahead, one that blends learning, service, and humanity. Thank you and all the best.